I'll be talking to you today about ear tubes in children. That's the journal article I've chosen. There are many risks and benefits of surgically implanting ear tubes, especially in children. The risks and benefits must be carefully assessed by parents and caregivers before choosing surgery for their child. I chose this article because I have a 14-year-old child who has undergone 9 to 10 ear surgeries from the time he was 18 months old up to the age of 12. And we have lots of experience with what the risks and benefits are, as well as complications because of his lack of ability for his body to process the tubes as they should have. Ear tubes are needed in children for a multiple of different reasons, typically because they have ear infections that reoccur frequently. The more ear infections that you treat in a child with antibiotics, the less responsive the infections become to those antibiotics. And left untreated or improperly treated, ear infections can cause hearing loss in children or other damage to their inner ear. Allowing fluid to remain in the inner ear blocks their ability to hear and does not allow them to perform well in school. The benefits of having ear tubes inserted include, but are not limited to, a lower number of infections, less severity of the infections, easier treatment for ear fluid and drainage, fewer complications associated with negative pressure inside the inner ear, and hearing preservation. The risks of having ear tubes inserted include, but are not limited to, frequent irritation at the site of the tube insertion, and this typically comes when you have multiple surgeries, such as my child did. You tend to have more scarring in the inner ear, which can affect future surgeries if they're necessary. Another risk is frequent ear drainage, and then the formation of cholesteatoma or a polyp. This is something that we also experienced because if left without an ear tube, if you have negative pressure in your ear and a cholesteatoma forms, it can grow into the base of your brain, which can cause lots of damage and can cause you to have your entire eardrum replaced. What are ear tubes? They're tiny cylindrical tubes made from various materials. Prior to surgery, the patient or the caregiver is given the details of what will occur during the surgical procedure, along with any possible complications. An anesthesiologist will contact the patient or caregiver either the night before the surgery or prior to the surgery in pre-op, and they will discuss any allergies you may have to medications or any trouble you've had with anesthesia in the past. The surgeon will also come in and advise you of the type of care to give to the ears after the surgery. During the procedure, the surgeon makes a small incision in the membrane of the ear. Fluid in the middle ear is drained from a suction. The tube is then inserted in the incision. At this point, air can flow in and out of the ear and fluid can drain from it. Post-op, the child generally recovers from anesthesia fairly quickly and is discharged within the hour. The need for tubes and why they help and possible complications are as follows. Tubes are sometimes inserted prematurely or not soon enough. It is best if a child can function without tubes, as any type of surgery can be risky. If a child ends up needing multiple tubes due to the tubes falling out or not functioning properly, scarring is a factor in the inner ear and can be problematic for future surgeries. Waiting can also result in a child performing improperly in school. These above factors are relevant because of the sensitivity of a child's ear and assessed need for tubes. Post-op complications to understand are as follows. Most children scream excessively post-op and cannot be comforted. We experience this every time with our surgeries. Some even vomit from the anesthesia. Parents and caregivers should be adequately advised of the possibility of all these complications. And to conclude, ear tubes are a valuable tool in the treatment of childhood ear infections. Preparation and information and research before and after surgery is key, and understanding the risks and benefits are necessary.